Gyurjyan. I'm a clinical psychologist. I am the head of our psychological services at Regional Center.
Okay.
So we can go ahead and start with, I know, the reason we're meeting is to discuss removing the intellectual disability from Ethan's file.
It's not removing, it's actually correcting an error. Because the issue is there was no basis originally to put it in the file. There's no documentation, there's nothing to support that diagnosis. And so it's unethical to put a diagnosis without some justification. And the justification Sarah told us was a developmental scale which is not used clinically to determine ID. You have an error in your files that needs to be fixed.
Okay, I understand what you're saying. So you feel this is an error. I can explain, I mean, I can go into why the decision was made to...
But it's unethical to make a diagnosis without an evaluation.
Right. So,
that's against the APA guidelines.
Just so you understand, we are not providing a diagnosis when we are making someone eligible. So the person who had my position before did not actually diagnose Ethan. The decision he made was that Ethan qualifies for Regional Center Services under these categories, which are autism and intellectual disability. So just so you know, we are not actually diagnosing him when we are doing that. We are determining eligibility under a specific category.
Autism is enough for eligibility, right?
Yes.
Okay, so the ID is not a requirement for eligibility. But the documentation we received says diagnosis ID, which means you are giving him a diagnosis.
So it appears that way because that's what
but this is a legal document. It's a legal document. If it says the diagnosis is, then that's what the diagnosis is. And what we're arguing is there is no criteria to give that diagnosis. So it needs to be removed.
Okay. So just so you understand, we do this with other individuals as well. We have cases where children come in and they don't have that diagnosis. But looking at the records and the information we have in front of us, we determine that they meet criteria for intellectual disability and we make them eligible. Now, in most cases, families do not, are fine with that because they agree with it. In this case, you don't agree with it, and I understand that. So the next step, what I'm trying to say to you is that it would be a disservice for us to take away from Ethan. It would be a disservice for us to take the intellectual disability label away from Ethan when, in reading through his records, it appears to me that it was a correct decision to do that.
Records review is not a legal requirement to give the diagnosis, right?
Records review is sufficient for us to determine eligibility under certain criteria.
As a
time.
psychologist, you cannot give that diagnosis by looking at records.
I'm not giving a diagnosis.
You just did. You just said that's his diagnosis. You're just contradicting yourself. You said, looking at the records, he needs the diagnosis of ID. That's what you just said.
I said, looking at the records, it is appropriate for us to have him under the...
There's nothing to do with appropriate.
But why is it appropriate? Autism is enough for him to receive his services.
Right, but do you understand that it is a disservice to someone if their cognitive abilities are in the ID range? It is a disservice for us to take that away from them because if this person, if you are thinking about conserving him, if you are thinking about
ramifications
of what could happen to him if he interacts with
Nothing
the
to
legal
do with
system.
this.
I think you need to understand that we need to have an
But in order,
estimate of his cognitive skills.
in order,
If we don't have a, but do not interrupt me, then you may talk now.
Thank you very much. I appreciate you.
you're going around in circles and telling me that if I need to do something legal, I need this diagnosis. Well, no, if I'm going to do anything legal, I have to do that formally, right? And right now you have no formal diagnosis. I don't care if you did a records review, legally you still cannot give him that diagnosis. He's getting the services he needs right now without that diagnosis. It's an indicator for you, for nothing else. As far as we're concerned, he has autism.
Could you help me understand why you would like to remove the diagnosis?
That's
Can you help me understand why, if it was put there incorrectly, why I should leave it there?
Well, as I said, I don't think it was incorrect.
Well, it is incorrect. There's no basis for it, so that means incorrect.
When he was 4 years, 4 months old, that's at 52 weeks of age. He was functioning at the 25-month level cognitively.
That was a developmental test that you're quoting.
Yes.
The Bailey scales is developmental. You can't use that to give a diagnosis of ID. That
Yes,
is
you can.
no, you cannot.
No, you cannot. That's unethical.
Yes, you can.
That's unethical.
If you go look at the actual paperwork for the Bailey scales, it says in there it's a developmental test, not a cognitive test.
It is a development. It is what you mean, sir, is that it's not an intelligence test. It's a developmental or cognitive test. It is a cognitive test.
No, it is
The
not.
area for cognition.
That's a screener. That's a screener. Okay, that's nothing. That's a screener.
I think you have to leave it to the psychologist.
No, where did you study psychology? Where did you study psychology? Where did you study?
I'm a licensed psychologist. You have a neuropsychologist with you. I'd love to hear from her.
No, first I need to know where did you study?
Please hear from the neuropsychologist.
Sure.
I'm the parents. Don't forget that. What a rude person.
Okay, I think what Mr. Sketty was trying to communicate is that we're not allowed to make diagnoses based off things like developmental screeners or records review. That actually goes against quite a few different ethics codes, so that would be a violation for somebody to give a screener and then render a diagnosis. Also, as a neuropsychologist, we don't use screeners or inventories to measure cognition because they're prone to bias. And even if you go to the Pearson website, it specifically says it's not a diagnostic tool. You know, we have to be very comprehensive. I'm sure you conduct a lot of assessments. So that would be, as you know, comprehensive assessment is the interview, it is more than records review, it's actual data collection, it's using psychometrics, it's all of those things. And I don't think that any of those things were given to the Shkeddies, and so that's why it doesn't make sense for there to be a diagnosis that was not derived from anything scientific or anything that would be congruent with what the AP Ethics Code tells us to do.
Dr. Sandoval, I appreciate you saying those things. I do want you to know that I have done many evaluations, actually in the thousands, and I actually I oversee the work of our psychologists. I also have lots of experience working with Rady's. I have seen many of Rady Children's Hospital, their evaluations. I see UCSD's evaluations. And you will find that what you said is correct. You cannot use one test to evaluate someone and diagnose them. However, you can look at a lot of data points, a lot of information in order to come to that conclusion. And I see that at Regional Center and I see it at Rady's, where the Bailey is actually, it is used to diagnose intellectual disability.
Well, then it would be used inappropriately then, and it would go against even what the Pearson website says. Anybody that's doing that then probably needs to go back and review their training on these scales because these are screeners.
Dr. Sandoval, do you do developmental evaluation?
I do. I'm actually,
You're
yes. I'm a clinical
psychologist.
neuropsychologist. I specialize in pediatrics.
Can I ask you a question?
Sure.
How would you diagnose intellectual disability or global developmental delay in a child who is under the age of 2.5? What measures would you use?
Well, you would use more than just the screener. The people who are inputting the ID here are doing it based off of whatever the results were of the Bailey, is my understanding, which doesn't make sense because it's not a diagnostic tool. It's to aid, it's to help that process. It's not in and of itself
Right.
a tool
So
to be
going
used
back
that way.
to what I asked you earlier, if you were the clinician and you were seeing a child who is 2.5 years old, how would you ever diagnose a child who is under the age of 2.5?
Well, I'd be more than happy to give you a consult at a later point, but I think right now the issue is that
No,
somebody
but I'm
put this
asking
into
a
the
specific
paperwork.
question. What they went for the Bailey, which was intended for younger children, and they were able to get him to do some things on the Bailey.
How do you
And
know?
how do you know you weren't there?
I'm reading the report.
Well, but the Bailey's
It's in
was
the
done
report.
before,
20 years ago.
Either one of us were even knew the Shketty. So what I'm trying to remind, I guess, the team here is that you're looking at old data at somebody else's screener and you're trying to render a diagnosis based on somebody else's lack of an evaluation. And you can't do that. That goes against all of the ethics code. You can't look at somebody else's score, somebody else's results on a screener that they did, and then formulate a diagnosis based off of that.
I have given you my thoughts on this. I believe that what Dr. Sandoval said is very reasonable.
I understand you study psychology, but don't manipulate and twist words. Do you understand that? Do you understand that? Because you're unethical. You're unethical. You're trying to manipulate. You try to twist things. Enough. No, don't tell me, Mr. Shketty. Don't. Was quiet. And I let you speak for the last. Okay? And you're talking about my child. Okay? You're talking about my child, and I'm gonna be on top of it. And you right now, you're inventing things. Excuse me. You're inventing things. You're putting things in his things, and it's wrong what you're doing. It's unethical.
His diagnosis of autism is enough.
You have autism diagnosis and you have verbal apraxia. You have verbal apraxia and autism. There's nothing to do with ID. Nothing. You're trying to put the ID, and I don't know why, and out of nowhere. So I think it's disgusting. I don't know how you look at yourself in the mirror. Don't smile, because what you're doing right now is disgusting.
So once again, we're offering you all for a...
No, you're offering, he had diagnosis of autism and verbal apraxia. Nothing changed. Okay? Right now you're trying to invent and put things in instead of saying, we're very sorry, mistake happens, we'll get over with, and that's it. Instead of that, you're trying to prove a point and make it like you going with an ego right now, saying, instead of saying, sorry, we were wrong, it happened by mistake, and that's it, and we keep going. But you're going to go on and on and on for no reason. So I want you to understand, if you're a mom like me, you would get upset too. It's my child. What are you doing? It's all of a sudden I'm going to come and start throwing diagnoses on you too. When you forced me to move you to your department a few months ago, I knew this is going to happen. Okay? I told them, I don't want to move to your department. You forced me to do that. I did that. Beginning is done nicely, and now you're like trying to cause problems for no reason. And I don't know why. And I want to know what's the agenda behind it.
Because as
I don't care, because nothing ever said that.
Change the format of the IPP so that...
Listen to me. I want to know what's the agenda. What is behind it?
Nick, we never saw it before because it was never on the paperwork.
Exactly.
That's why we
That's
asked.
just the point that I'm trying to make.
And that's why we're asking to remove it now, because this is the first time we've been made aware of it.
Can I interject?
Go
I
ahead.
understand your concern, and I just want to say that we have.
I'm saying it's unethical. What you're doing right now is unethical. It's disgusting.
I was not here.
Right, so why are you even here? I didn't ask you to come. I didn't want to talk to you. They forced you on me. I don't even know you. I've been forced to talk to you right now.
At this point, I think the best option is to end the meeting.
What you're doing now is unethical.
And I think
You are abusive.
It ceased to be productive at this point. So I think at this point we should just end the meeting.
Do whatever you want. You force it on me.
Okay, thank you.
You're welcome.
You